Alrighty, welcome to Romera Records virtual cast. Today we have on Macee Rush. How's it going, Macee?
Good. How are you?
I am great. So, found you from Instagram. As I said, my wife always books my podcast, and so she found you on there and was like, "Hey, would you want to talk to a nurse?" And I was like, "Sure." So yeah.
And I was very excited. It's so nice when you actually feel pretty average, honestly, and then somebody takes interest in your seemingly like very average life and says, "Hey, like we would like to talk to you and have you on our podcast." I'm honored.
Awesome. Yeah, I think it's pretty cool talking to people who are in a profession that everybody thinks they know everything about, right? Like a lot of a lot of people want to diagnose themselves or like, no, you should do this or no, you should do that. Like
Right.
it's kind of fun getting the facts from the people who are the professionals, you know. So I hope we can debunk some myths and talk about whatever throughout this podcast. But
Sure.
if you could go ahead and explain, I guess, a little bit of what you do. You're a traveling nurse, right?
I am. So I got my degree from the University of Memphis. It was not really the initial plan. I had a degree in psychology from Mississippi State, um, and I worked in psychiatric hospital for a while. Got my nursing degree, kept working at in an inpatient psych facility for a bit. Transitioned into nursing at that hospital. And after working there for a little while, I wanted to get more medical experience. So I worked at the Veterans Hospital in Memphis. That's where I started like kind of getting my more medical experience. And I worked as a med surge nurse. So that's kind of like the beginnings of that. Then over time, life happened, um, and due to personal circumstances, that's when I became a travel nurse.
So, how was you said you worked at the veteran hospital. You talking about the VA?
Yeah, the Memphis VA, and it was a fabulous experience.
Yeah, I was going to ask about that because the patients are a little different. I was actually in the Air Force myself, so I've
Oh, thank you for your service.
thank you. Yeah,
I
so
appreciate it.
I've been to the VA hospital and good
Yeah.
people down there. But
Hmm.
I feel like um, people who are working as civilians in a VA hospital, they're probably thrown into a different world because the patients are a little different people. So, can you explain like the difference, I guess, in the people working with veterans compared to your everyday civilian?
Well, so I think in a way it is different, but it's also still similar. Typically, working as a nurse in any hospital, you're not often working with younger, healthy people. You're more so working with older individuals with um, already pre-existing health conditions. So I was working with an older population, um, which yes, they're veterans, but they're also older, like aged veterans versus younger veterans. So you're dealing with a different mindset, a different culture, if you will. They're born in a completely different time. So I was, fairly young in comparison to pretty much all of them. There's so much respect that you have for veterans in general, but then you have the respect for your elders. So it was almost kind of like if you can imagine just every day taking care of like your grandma or your grandpa. And I just you have to humble yourself and you also have to like you're from Alabama, like you yes ma'am and no ma'am them, yes sir, no sir, um, and you kind of have to, while you have your like medical knowledge and you're wanting to tell them what's best for them, you also have to respect that they've come to this point in their life on their own to an extent, and you very much take that into consideration when caring for them. You want to tell them this is what we need to do because this is how I can best care for you. But you have to remember that they've gotten to this point in their life doing things a certain way. So that taught me a lot. It's like my way is not necessarily the only way. My way is not necessarily the best way. And they were really incredible people to serve and to work with. So I very much enjoyed it. And then a lot of the nurses I worked with as well were also veterans, and that was a great experience.
Do you think that there was a difference in, I guess, the education of like a of somebody who was a veteran nurse compared to somebody who's always been a civilian? Because a joke in the military we have is that people who are doctors and nurses in the military couldn't cut it in in the real world. But we just joke about that just because, it's a, I guess, an easier route because the military loves to take in people who are willing to be a doctor or a nurse in the military because the money's way better outside of the military, but you get taken care of in the military. But did you notice a difference in education or anything?
Um, I wouldn't say I noticed a difference in education. I I think I noticed a difference in maybe like just life structure in general because I do think the military, as somebody who's a civilian, like entirely, I think the military does teach you incredible structure. And I almost think you take direction better than other people might. Um, because if you don't, like, obviously you don't survive well in a military setting.
Yeah.
So I do think that in some ways it makes it easier to be a nurse or a even like a resident physician, because you're a little bit more used to or okay with somebody telling you what to do, like taking orders, if you will. Like as a nurse, I don't do anything unless I have specific orders to do it. But as a civilian nurse, especially, or just, in nursing school, you're taught to protect your license, like question something that doesn't seem safe. Um, and maybe if I had a military background, I don't know if I would question it as much. I don't know because I don't know the other side of it. But I could definitely see where it would make a difference, having a military background versus a more civilian background. I don't know if it makes any difference though, education wise.
Yeah, I mean, there's so many ways to skin a cat when it comes to that kind of stuff because like, every I would probably say every school isn't the same, right? Like when it comes to
Yeah,
education as far as medical wise or even if you're like a teacher, every school is not going to be the same. So, uh
right.
yeah, you're going to get differences somehow. Uh so you were talking about basically the what was it? You had said something, and I was thinking about just like the COVID, like everything that's happened with COVID and how that has affected the hospitals. Period. Well, everybody,
Right.
but hospitals specifically. Um, how how did you see the world change going through that?
So I'm sorry, my dog's bringing me her ball
Oh
and
no, you're
wanting
fine.
me to throw it. I was a fairly new nurse when COVID. So I graduated from nursing school in December. I guess it was December 2019 or 20. I can't even remember. It's like all a blur.
Yeah,
I went and worked. I just basically transitioned into a nursing role in the psych hospital. And then I went to the VA. I did a nurse residency program. So you receive a little bit of extra training, and you get to see like different settings. So um, once I reach the floor that was going to be like my floor, my permanent floor, my med surge floor, medical surgical, if you will. I I started training under another nurse, and then COVID kind of came about, and they said we we need everyone to operate as independently as possible because we are short staffed. There was a lot of nurses who were at a retirement age, and the pandemic scared them, and they said, we're just going to go ahead and retire. This is pushing us. We're going to go ahead and retire. So you had a mass exodus already of older retirement age nurses. So then it fell on the new graduate nurses to operate independently before we were actually trained appropriately.
Yeah,
Not only that, but they were bringing in nurses, LPNs from other areas like elective surgery areas, and basically having us train them as new graduate nurses. And it was scary. So like I would have an LPN assigned to me to work with me,
dang.
to give my medications to patients, and I barely knew my role. And it was honestly like so scary. I mean, it teaches you quickly, but also I take what I do as a nurse very seriously, and I affect lives, and you never want to negatively affect a life. And that was my only thought for so long, was I only want to help and not harm anyone.
Mhm.
And COVID put new graduate nurses in a very difficult situation with that.
Yeah, I mean, it definitely threw everybody in for a loop. And like when I first started hearing like the stories of what's going on in hospitals and how nurses and doctors have to deal with everything, I was like, that sucks, because it's one of
Yeah.
those damned if you do, damned if you don't type of thing when it comes to like wearing masks and all the precautions and stuff like that. Because, if whatever the hospitals did, that's what everybody was going to lean on, right? Like
Right.
um, the who was pretty much like, all right, everybody do this, and then everybody's like, okay,
Yeah.
you're our health leaders, and then
And the rules changed
yeah.
every day. Yeah.
So I was like, there's no win when it comes to hospitals, because everything they do is wrong. Like if they think, all right, it's okay to take mask off, then everybody's going to be like, oh, you did them too early. And I felt the same way
Mhm.
with the presidency, like whatever they were saying. And it's not like our presidents are doctors, you know what I mean? So whatever they're saying, it's going to be wrong no matter what. Like they didn't have a choice in the situation. So I definitely applaud however you had to handle the situation, because that it sucks, and like it's being in between a rock and a hard place. So do you feel like that was, I don't know, maybe a good experience to have as soon as you get in, because you kind of had to deal with something so crazy?
I um so yes and no. I think there's a lot I could have learned had I had a preceptorship, where I could have actually had an experienced seasoned nurse teaching me what I needed to know for the length of time that I needed to know it.
Hmm.
Um, but also, uh, so a lot of nursing is just how well can you cope with stress, and like how can you think on your feet, um, and you're in a pressure cooker environment. So like for example, when the pandemic happened, again, I was a new nurse. I was learning my role like on a basic level, but then they say, okay, well, now we have this virus and we don't really know how it affects anyone. And we don't really know what the appropriate steps to take are to protect yourself, but somebody has to take care of these patients. So they've said, okay, well, randomly every shift, when it's your turn, you will go to the COVID floor. So very quickly, I'm a new nurse, my turn comes up and they send me up and they make me put on a pair of scrubs that like over my scrubs, like hospital administered scrubs, um, PPE, like the yellow gowns over it, gloves, shoe covers, a hair cover, an N95 mask, a surgical mask over the N95 mask, and then like the spacesuit, like capper,
Dad,
like
go.
the helmet. And then they had cut off all air conditioning to that particular unit on the floor.
Oh man.
So you're wearing so many layers of clothing and PPE, and then there's no air conditioning, and you're from the South, you know how hot it gets.
Man.
So I remember too, so like the spacesuit situation that you wear, it's constantly it makes noise like in your ear because it's constantly blowing air. So it makes it difficult to hear. Then you're on a floor, it's like entering like a hazmat area.
Yeah.
Everyone else is dressed like you are. You can't hear them. They can't hear you. Your patients can't hear you. You're dealing with, it's a respiratory illness, right? So when people have prolonged periods of time where they're not getting adequate oxygen to their tissues, they become extremely confused. And part of that confusion can result in violence. So I found myself in a situation where a patient was extremely violent, larger than I am, stronger than I am. I can't call for help. No one can hear me. I can't press the call button. That's not working anymore like it normally would because of the setup we have now. And it definitely broke me in, if you will,
Yeah.
to what nursing would eventually become for me. But it was also really scary because I hadn't had situations like that before. I hadn't dealt with that before. I wasn't well versed in nursing at that point, and it was very like anxiety provoking and scary. And you do have to take those breaks, like to go like care for your own mental health, and but I think in a lot of ways I would say mostly helpful, but definitely a unique experience.
Yeah, it's such a unique time that we experience this, and thank God it happened. I mean, of course, we had stuff like the Black Plague back, forever
But
ago.
that wasn't our time.
Yeah,
Yeah, we don't know that,
yeah,
you
but
know.
like, it's nice that it happened at a time where we have like all the technology that we have, and we were able to deal with things in a certain way. We have like Zoom to communicate, and using the use of cell phones and stuff like that, like we're able to still like help people. Like imagine back when the Black Plague happened, like nobody knew in far distances what was going on, and I don't know
Right.
how fast it spread, but like imagine if COVID happened now without all the technology that we have. Like, you know, you wouldn't know somebody had whatever in like the distance wise.
You
So
wouldn't know it until they were sick, yeah, or until
yeah,
you got news that they were dead. Yeah, absolutely.
so
And so yeah, technology has played a huge role. I don't know that, like, we've seen a lot of loss, we've seen a lot of illness, and we've seen a lot of death. And I think technology um, has played a huge role in allowing people to still be a part of kind of that end of life situation, which is a very intimate situation. And it's kind of like everyone has the right to be a part of that, like with a family member who is in end of life. But because of COVID, we weren't allowing visitors for a long time. So it's almost it complicates grief to have a family member pass away and not be part of their last so many days. So because of like, FaceTime, Zoom, whatever, we were literally allowing families to have those last conversations and have those last memories with their loved ones who were not even just passing away from COVID, but from any illness at the time, because we weren't allowing visitors in hospitals at all for a while. And I actually found people to be very appreciative of the time that nurses took. One of my the first moment I can remember being appreciated as a nurse was when I got an edible arrangement, like a fruit basket, basically from a family. It just said, "Thank you so much, like for the time that you took to allow us to communicate with our father, who was he didn't have COVID, but he had a terminal illness, and we took the time every day to allow them to communicate with him until he couldn't communicate anymore, and that made a huge difference for that family. So technology definitely has played a huge role in all of this, like I would say in a very positive way.
Yeah, and so when it came to like, I guess you like coming and going from the hospital, was there any like I guess time gaps of when they're like, all right, so many people need to stay here for this amount of time, and then like, all right, then we can swap people out, or did your schedule stay kind of normal?
Um, Actually, so they began mandating us to stay for extra hours, and it wasn't excessive for me. But so like a mandate would be, okay, you've been here for your 12 hours. But we actually don't have enough nurses to accommodate the number of patients on the floor for the next 4 hours. So you need an extra 4 hours. And so and there would be times where that would be very difficult to accommodate on a personal level because you make plans. So you would say, I mean, of course, everyone pushes their limits and they say, well, what are the consequences if I don't? You know,
What are you
what
able
are,
to do?
I know, yeah. So that's your first. I mean, that's what are you gonna do if I don't? Because you're upset. Like if you've got to cancel, like a dinner with your like spouse or a birthday party, whatever it may be, and the actual reality of that a lot of people don't realize is they can threaten your nursing license
Oh,
if you don't stay. They call it patient abandonment, and if you leave, I mean, there is a limit to how many hours they can keep you, but if you don't stay the limit when they mandate you, they can actually threaten your nursing license, which threatens your entire like career and livelihood. So you have to stay, like you have to be there. It works a little bit differently as a contract nurse or as a travel nurse, but I mean, somebody has to be there that at the end of the day, like someone has to be there to care for these sick people.
do you feel like being a traveling nurse was something that came out of this COVID situation, or were you already planning on like, yeah, I'm gonna be a traveling nurse anyways?
No, to be very vulnerable and on a personal level, I won't go into too many details, but I was in a roughly 4-year relationship. I was engaged. Um, Circumstances happened that we ended the engagement. It was a very difficult time and situation personally. And it was kind of one of those moments of, this is an option for me. This will benefit me personally, because it'll put distance between me and this painful situation. And it will also benefit me as a single female financially. So even though it was very uncomfortable, very difficult, it was probably the best decision like I could have made. And it was the best opportunity. And it was something that, even though it was hard, like I could not be more grateful. And I feel so blessed that like that was that was the turn that my life took. Because it's been a year. I've been next month will be my 1 year anniversary of travel nursing.
Hmm.
And I've met the most incredible people. I have actually my best friend, she's here right now. She's visiting my town that I'm in right now. And we were reflecting on it. If I hadn't, I wouldn't have met her. I wouldn't have met just some of the most incredible people that I have in my life. And, you know, as an adult, making new friends is an incredible thing. And I know that I've made lifelong friends and I've had experiences that I wouldn't trade for anything. So it was never in the plan at all. But I'm so grateful for it.
And how old are you?
100%. I just turned 29 on the 16th, a few days ago.
Oh wow, happy belated.
Yeah. Thank you.
So I'm actually 29. My birthday's in July, but
Okay, cool.
um, do you feel like, see, something that I always preach to people, our age, younger, older, everybody, is how short life really is. And I think, at least I feel like a lot of older people and people our age feel pressured to like have their life together by 24. And it's like, and it's like that's not even realistic whatsoever. You don't even know who
Right.
you are as a person at 24. Like you have so much more time to grow and to do other things. And I'm curious, if you did you feel like your life maybe just grew exponentially after the engagement broke off, and now you're like, all right, now I'm traveling, I'm going places, I'm meeting more people, like your world just expanded.
Yeah, I will fully, I think everyone's journey is important and everyone's journey is unique to them. And getting married young can be a beautiful thing. Having a family young can be a beautiful thing. Like I would never frown upon that or say that that is not a good thing. But I do also 100% back the idea that um, leaving your hometown, traveling, living somewhere other than where you grew up is such an inspiring and formative experience. Like being around people that are different from you. And not just like, you know, like taking a vacation, but like literally living around, being around people with different backgrounds, different ideals than you, different opinions, and just you realize that there's only so many degrees of separation. There's only so many things that make you different from anybody. You have so much in common with so many people that you wouldn't think that you did before. So yeah, I have learned so much over the last year. I'm not, I would say that like, even though I was in like my comfort zone, I had a lot of anxiety uh being at home in my hometown, being in like a comfortable relationship. And I would say after all the difficulty and uncomfortable situations and leaving home and being alone, I I'm actually less anxious now because I'm like, you know what? No matter what happens, I'm gonna be okay. I can deal with this. I can handle this. And I travel with like I say my best friend. She's my dog. I have a Australian Shepherd Poodle mix. She's really cute, and she goes everywhere with me. So that's she's my little comfort blanket. But yeah, I would say like I kind of did really start living or like experiencing life in a very exciting way once I started traveling. Yeah.
Yeah, I always think it's so unique when people are able to have that realization because, as I said, I feel like people, when they're younger, they just have this pressure of, I need to get my whole life together. Like once, you graduate high school, you go to college, and now you're supposed to make millions of dollars doing the job that you went to college for, right?
Yeah.
So that it's just not realistic whatsoever. And once you realize that, once you realize, life does not go the way that you planned, you start getting out of your comfort zone because you're like, oh, that one thing didn't happen the way I planned. So what happens if I do this? And then what happens if I do this? And then you just start to live a little more. Like you realize, all these things that you can do and you can accomplish, and you take that trip to Hawaii that you always wanted to, and you
Yeah.
might go to Bangkok, Thailand. Like, all these things are now possible when things don't go your way, and you kind of have to you grow up, and you feel a little different about, I guess, the way your life could go.
Yeah. And you do you I feel like it's but you're from the South, right? From Alabama. And especially being raised in the South, and then especially the female, it's like find someone, get married, settle down, have children. Your parents want grandchildren.
Yeah.
And I think you start to realize that there's also value in waiting. There's value in traveling with traveling by yourself and traveling with the person you love and waiting a little later in life to have children so that you can pass the knowledge and experience. And I feel like a lot of it, you have this like I said, like almost an inner peace from your experiences, like reduced anxiety. The more you experience, the more you realize you can handle. And I feel like when it does come time, if you do want a family, if you do want children, you can kind of pass that on to them. Kind of that level-headed mindset of, whatever you go through in life, like you have options, and you will be okay. Like there's no need to. You should worry to a certain extent. You should be hardworking. I fully believe in work ethic. I fully believe in um, honest work and working hard for what you want. But I also believe that work and um, the material things and your timeline, it shouldn't be the end all be all. And like you said, if it doesn't go according to plan, you shouldn't just stop enjoying your life because your plan didn't go 100% as planned.
Yeah, I actually did a podcast with a girl, and I think she was from, I want to say Minnesota or Idaho. I think it was Idaho. And she she said that one day she just wanted to teach somewhere, and then she started looking for jobs, and she ended up she ended up getting a job in Japan teaching English over there. And I was like, that's pretty crazy. Grew up in Idaho her whole life. Like,
Yeah.
there's about so many kinds of different people in Idaho. Maybe Boise might be a melting pot because there's an Air Force base over there, and so I think her dad was in the Air Force. But yeah, and then just up and moved to Japan. She knew no Japanese, knew nothing about the culture, just knew that that was an opportunity to go do something that she wanted to do in a place that was different. And I was like, good on you. And I was like, wasn't that like scary and crazy? She was like, yeah, it was, but it's worth it now. Now she's married over there, and she's having the best time of her life. Just teaching. And I was like, that's so wild. And she was like, yeah, I suggest everybody do something like this. And I was like, that's crazy.
Right. Yeah. So I will I'm not gonna get too far into religion, but I do know like the Church of Latter-day Saints, their youth, their young people, they go on mission. And it's mostly the males that they send to like different countries, to like more difficult areas, but um they send them abroad. Um and really all of them, they go somewhere other than where they live, they go somewhere other than their home, and they go what they call on mission. And it's really to spread the word, like to teach people about their religion, but also it provides them with an experience that's different from what they've always had. um, it gives them what you were talking about, that unique experience. And it teaches them about different cultures, and it teaches them about different religions, and it teaches them that there is so much life, and there's so much to be appreciated beyond what you've always known. And like I truly admire that about them. um and but I never knew anything like that in my life. And it's not something that I grew up appreciating, and no one ever pushed me to go anywhere or know anything other than what I already knew. So I think it is just super valuable. And if you get the chance to do it, I think it's something that you should do, and it's something you should value.
How are the other I'm assuming you work with other traveling nurses, correct?
Hmm.
Do
Yeah.
do they have similar experiences to you, or were they like, full on, yeah, I've always wanted to be a traveling nurse?
So I'm currently in Ohio, and most of the nurses that I work with here that are traveling nurses are locally, they call themselves local travelers. So they are from other areas or other cities and towns in Ohio. It's not super common here in Ohio that I work with other traveling nurses who are from areas so far away as I am. I'm kind of like the oddball, like
Yeah.
the odd person. Um, most like I'm in Columbus, and a lot of traveling nurses here from like the Cleveland area or Dayton or Cincinnati. Some are from like I have one who I've gotten to know really well. She is from um, West Virginia, but that's just like 3 hours away.
Hmm.
So there actually are a lot of travel options, but they're local. So you can actually have your home be like 2 or 3 hours away and still be considered a travel nurse. I just so happen to be 9 hours from my hometown, and but I kind of like it that way. I was excited to get far away. So no, I haven't met very many travelers who are in my situation being so far from home.
Would you say you're a people person? And if you aren't, how has that affected your, well, I guess you probably are just doing this random Zoom with this random guy. But would you say that that
Yeah.
has helped you as a nurse? Like you're having these interactions with strangers every day. Does that help?
Yeah, I think it certainly helps with patients. Now, I also know nurses who are complete introverts who are the most like kind and compassionate nurses when it comes to their patients. I think as a travel nurse, as a nurse in general, when you go to a new hospital, you always have to build trust with especially the other nurses you work with. And you want to, because if your shift is going poorly, if you have a very difficult patient load, you want help, you need help. And it's safe for your patients for other nurses to help you. So when you're kind to others, when you're genuinely interested in other people, when you come in with a humble, I'm here to help attitude, y- you gain that trust, and they want to help you. They say, okay, I see you having a difficult day. I see you struggling. Let me come help you with your patients. And I've made, like I said, I can't say it enough. I've made some of my best friends. And like, I've met so many people that I will never lose contact with through travel nursing. And they are mostly people that I've met in the hospitals, because you work for 12 to 14 hours easily, and that's a lot of time to spend with people, and you're in a very stressful environment, and these people can literally make or break how your work life goes. And so yeah, I think being a people person and being friendly, I joke, but I think anyone would say, I'll talk to a brick wall. Like, we're gonna be friends, we're gonna be cool, whether you want to be friends with me or not, like, we're just gonna be, and eventually you'll accept it. Yeah, so I think it 100% helps. It makes it so much better.
And I ask that because, it could be a bad thing if you are very friendly and emotional. You wear your heart on a sleeve because you're dealing with people who are sick and they could pass away at any moment. So, if you're that type of person, I don't know if you've ever worked with somebody like that when they're just like an emotional wreck every time they see, somebody pass or something like that. I've always thought that that's such a difficult job. If you're a surgeon and now you got to go tell the family, what happened or whatever, that's like, man, like those are mentally tough people to be able to, number one, to be able to work on somebody, in that kind of state, somebody who's, um, gone under anesthesia and you have to like, all right, you're in charge of their life now. Like that takes a lot of mental state, but then also having to deal with, something going wrong. Uh, so that yeah, that's why I ask about being friendly and being talkative to people and stuff like that. How that affects your work relationship with the patients and whatnot.
Oh, well, yeah, well, so there's a level of professionalism with patients. You don't really get as personal with patients as you get with coworkers. So that's where that separation is. But I will say, there are certain patients that you inherently become a little bit more connected to, a little bit more attached to, whether that's the length of time that you take care of them. It depends on their situation. It depends on their family involvement. I've had patients who I just had them in my care for a couple of hours and they passed. And that's never, that's, that's certainly never a happy situation, but it's a much easier to cope with emotionally than a patient that you have seen have good days and bad days, and you've cared for them for a long time, and then you lose them, and then they pass, and you've spoken with their family a lot, and you have like fed them, cleaned them, you've laughed with them, you've held their hand, like whatever it may be. Those are the ones that are tough. Not all losses. I mean, all losses are difficult, but they're all on a different level of difficulty as a nurse, depending on your involvement with that patient. And the worst is when you don't expect the loss and you feel that even though there was nothing you could have done differently, you can't help but go home and feel like, play over in your head, what could I have done? What could the, what could the whole system have done? And sometimes it has nothing to do with that, but you, as somebody who's so involved in their care, you can't help but feel that way sometimes.
Um,
So,
so a little bit on a lighter note, your entire work is just like Scrubs and House and The Good Doctor, right?
oh yeah, for sure.
So what are some things that actually I had a friend who went through nursing school and she told me she went to, have you ever heard of UAB in Alabama?
Yeah. Hmm.
So she went to UAB and she said like one of the first days that she's in nursing school, like I don't know what class or whatever it was, but I think it was the professor or whoever was like, if you're here because you watch Scrubs or House and now you want to become a nurse, just get out. And I
Just
was like,
go.
oh, I was like, oh my god, but
It's true.
there's probably a lot of people who do that, right?
Yeah, it's not, there's no level of glamour to it at all. Yeah, if you I had a lot of actually had a lot of uh fellow like students at University of Memphis who their whole life they had wanted to be nurses. And when it came down to actually going to clinical and you have to clean up, like you have to have a bed bath and you have to change bed and you have to, I mean, you literally have tubes that go directly into people's stomachs and you pull stuff out and put stuff in, like not to get too graphic, but when it came down to it and things did get very graphic for them, that's when they were like, my lifelong dream, suddenly not my lifelong dream. It's not glamorous. It's dirty. It is emotional. It is difficult. So yeah, for sure. And they were brilliant people, very intelligent students, but there's a separation between like I know all the facts, but being in this setting, it's not for me.
Yeah, and I knew a girl who was a EMT, and she she said that she can deal with like blood and brain splattered and stuff like that, but she hated slobber. She was like, if somebody slobbers on me, I freak out.
I
I
think
was like,
they call it sputum.
sputum?
So it's not like drool. So there's like drool that comes out of your mouth. Sputum is what most nurses can't handle. And sputum is like if you're like, like hock a loogie, like
Mm.
that snot that comes from deep down in your lungs or in the back of your nose. That's what is inherently very difficult for most nurses and doctors. And I don't know, I think it's a consistency. Yeah, it's sputum, and
That's
it's
pretty
that's our word for it, and it is not pretty.
rough. So what are some things that I guess get to you?
Uh Sputum is if so like people have trachs, which is like, a hole right here in their throat that helps them breathe. And a lot of times, really sick people, they'll have the sputum come out of that like particular hole and it has a certain odor to it. Like
Ooh.
I know it's gross. I know it's just it's not easy to it's easy to talk to other healthcare professionals
Yeah.
about it and they get it. But it's like so normal, like it's so normal for the people that you're taking care of. But that's something that's difficult. And then I remember one day I had a patient who had, we call it a peg tube, and it's a tube that goes directly into her stomach. And that's how she gets all of her nutrition and her medications. And I had it open, I was feeding her, she coughed, I took a shower in
Oh no.
stomach contents. Um,
Oh my God.
yeah. Uh, so there's degrees of separation, and sometimes when you just physically, your hair, things come in contact with certain bodily fluids, you just feel uncomfortable and it's difficult to continue with your day at that point.
Yeah, that one of my biggest things is I don't like being wet with my clothes on. And so, yeah,
I
it's
get that.
weird. Yeah, I just
Yeah.
don't, I can't stand it. Like even if I'm like watching a movie or a TV show and
Mhm.
somebody just like is trying to save somebody and they just full clothes just dive into a lake or something, I'm like, nope, I would have stripped naked and I would have jumped in. Like I'm not getting my clothes wet. I mean, it's I don't know, it's
Right.
just a small thing, but I could imagine going through that. Like like what you
Yeah, or
do.
like one day, like I emptied a colostomy bag. A colostomy is where someone's bowel empties into a bag that's attached to their body. You have to empty that bag, and so it's it's poop. And we have this. It's a I think it's a bacterial infection. It's called C. diff or Clostridium difficile, and it's very contagious. And it may basically results in just like massive diarrhea, and it can actually kill someone if they become too like dehydrated. And it's really resistant to antibiotics, but it's actually really common in hospitals. So one day I was emptying a colostomy bag from a patient, and very watery container full of brown water, if you will. I dropped it and it hit the toilet and it splashed
Oh,
everywhere. And but it was the end of my shift, and I got to go home and promptly wash it off. But yeah, I mean, these things don't happen often, but if you work do it enough, it will happen. Like accidents, it happens. So yeah.
that's pretty wild. Like I don't know what I would do. Like that's that is the wrap. That's a wrap on the day right there.
Yeah, you're done at that point. You're ready to go. You're just
So
gonna go home and burn those scrubs.
yeah, yeah. So what are some things that I guess you haven't done that you would like to do in your career field?
I eventually so there's so many options within nursing, but I eventually like my if everything were to go perfectly as planned, which we have both discussed during this conversation, that things don't always go to plan, and sometimes it's best when they don't. But when I'm finished traveling, I'd like to settle down somewhere. I don't know where yet, but I would like to go back to school and become a nurse practitioner and do mostly aesthetic work, or maybe even work within the realm of plastic surgery, uh, doing like reconstructive surgery with trauma patients, cleft palates with children, um, just more in the plastics cosmetic area. And that could cover everything from literally just like Botox and lip fillers to a patient who's experienced a traumatic car accident and is needing reconstructive surgery. So that I kind of want to move more towards that. I don't have a timeline in mind about for when that would happen, but I feel like that's something I'm like passionate about, and that's where I would like to, when I advance my career, that's the direction I want to go in.
Is there anything that you feel like would make that more difficult other than, you know, the schooling itself, or, you know, finding a place that you want to be, stuff like that. But any big obstacles?
Um, I I do think, and it wouldn't be a bad obstacle, but if I were to like find somebody and get married and have children, I think having children and wanting to be a mother and being present and spending a lot of time with my children, I think that would kind of make it more difficult to focus on school and advancing my career. It most certainly does not make it impossible. Women do it all the time. But yeah, I think that would, because I'm at a point in my life where I would love to uh meet my person and have children. So it would be difficult to prioritize furthering my education and career because I would be so excited about a family at that point. I wouldn't call it an obstacle, but it would be difficult to dedicate the level of like attention and passion to both that I would want to. So
Um, so when you are traveling, is there something that you like to have with you? You know, or are you just like are you do you have any like material things other than your dog, of course? But
yeah, she's the first thing that came to mind. I have my mom. Uh, if there's ever anything I need that I don't have with me, she mails it to me. I manage to make it home as often as I can. I will say space saver bag, like the ones you see on the TV where
yeah,
you like use the vacuum and they like vacuum to impossible sizes. I use those when I travel. It's much easier to pack in my car, but I really don't travel with anything more than what I can fit into my Rogue. I don't use a U-Haul. I rent apartments that are temporary leases. So most places will only rent to you for a minimum of like 6 months.
mm,
The places that I rent are, I come into it, telling people I'll probably only be here about 3 months or so. They're fully furnished. They have everything I need to cook. Um, I literally own none of the furniture that's in my apartment currently, like this where I'm at. So everything that I pretty much bring with me is my dog, my clothing, shoes, not much else really. And that's kind of freeing to know that it is that easy to pick up. And you've heard of Marie Kondo. If it doesn't bring you joy, get rid of it or you don't need it.
mm.
And to an extent, yeah, it's kind of like that.
All right, let's wrap this up. I usually have people who have something to promote, but I mean, is there anything that you that you have or anything like that?
Um, I don't have anything to promote. I mean, you can follow me on Instagram. It's I kind of use my Instagram as a my mom who doesn't come from the social media era says, you need to keep a journal with all your travel experiences in it. You need to, or like, a photo album. And so Instagram is like my it's kind of like my photo album. I like how I document significant events in my life. I don't use Instagram to promote anything else other than it's just documenting me, my dog, and our travels and the people we meet. And also, I would just promote everyone making time for like their like mental and physical well-being, no matter what your career is, and just literally taking time to check in on yourself and make sure that you are well and healthy.
Wise words. Wise words. Well, thank you. Oh, what's your Instagram? Tell her about your Instagram.
Oh, I am at Nurse Macee. So at Nurse Macee. And that's me. And then you'll get to see Poppy. That's my dog's name. She's like way cooler than I am. So she's in almost she's at least in like every other post. So it's pretty much her Instagram. Yeah.
Awesome. All right. Well, thank you so much for doing this, and
Yeah, thank you.
good luck in all that you do, for sure. All right.
Thanks.
Well, thank you for
All
everybody.
right. Thank you for having me.
Oh, you're welcome. Thank you for everybody tuning in, and we'll see you next time.